Hi, my name is Jinyu and I'll be speaking about the bilateral subthalamic stimulation in patients with Parkinson's disease. A little about me. I'm from Brooklyn, New York, and I started the first public health club at my school. I currently run an international youth forum to empower women in STEM fields, and I volunteer at the New York Aquarium. I'm also interested in the fields of biomedical engineering. This is the agenda for today's presentation. A little introduction on PD. 10 million people worldwide are living with Parkinson's disease, are also known as PD. According to the Parkinson's Foundation, these people are of different ages, nationalities, races, and genders. The standard of living and quality of life for those living with PD raises arguments revolving around the effectiveness of new advancements in biomedical engineering, as well as the importance of improving the quality of life and standard of living for PD patients, both in nursing homes and those taken care of by family. So, symptoms of Parkinson's disease. Early in the course of the illness, movement-related symptoms, including shaking, stiffness, slowness of movement, and problems walking and moving around, are particularly obvious. As the condition progresses, behavioral and cognitive problems might later develop, and dementia is usually observed. Sadness, sleep problems, speech problems, and coordination problems are also other warning signs and symptoms. The quality of life. Due to the social, physical, and mental effects of the condition, patients with Parkinson's disease often have a much reduced QOL level, which measures the average quality of life of an individual. PD can also increase motor or cognitive symptoms, which are some of its well-known symptoms as discussed on the last slide, but it could also have lesser known but major negative social effects, including stigma, dehumanization, and loneliness. The advancements in biomedical engineering relates on the subject of enhancing overall quality of life, which is crucial because therapies and treatments like DBS are also known as deep brain stimulation, and other therapies and drugs for PD patients can only temporarily lessen symptoms like tremors, but they can't necessarily reverse the illness's consequences or stop PD as a whole. The socioeconomic disparities between residents of different nations and those who don't conform to the status quo are also closely correlated with the average quality of life, and that factor is also taken in when considering the effectiveness of such treatments. So what is the bilateral subthalamic nucleus, which is also well known as BSN? Along with the basal ganglia, the subthalamic nucleus's main job is to regulate movement. A collection of subcortical nuclei known as the basal ganglia, which was discussed before, also play a number of cognitive and affective roles. And on the graphic of the brain here, this is where the BSN sits on the brain. So during a process known as deep brain stimulation, or better known as DBS for short, a device that provides electrical signals to parts of the brain that control movement is implanted, and deeply implanted electrodes in the brain are also linked to a stimulator device, like a neurostimulator like this over to the graphic on the right. And the installation of a neurostimulator helps decrease the consequences of Parkinson's disease-related stiffness and tremors. And this is the lead that the neurostimulator is attached to via a lead wire and an extension cord. So during the deep brain stimulation surgery, electrodes are positioned in a certain region of the brain during the deep brain stimulation surgery, as shown before, depending on where the symptoms are being treated. So it varies, and small holes are actually drilled on top of the skull, and they're used to insert the electrodes into the left and right sides of the brain. And the electrodes are attached to a battery-powered stimulator underneath the chest skin by lengthy cables that pass through the skin and down the neck. One of the pulse stimulators could also look something like this. And according to the Mayo Clinic, there are also possible consequences of deep brain stimulation surgery. So the implications of DBS surgery include displacement of leads, bleeding in the brain, strokes, infections, breathing problems, nausea, heart problems, seizures, and more. And the side effects of DBS surgery could include seizures, infections, headaches, confusion, difficulty concentrating, strokes, hardware implications such as an eroded red wire, and a temporary pain and swelling on the area that was used during DBS surgery. Another topic, which is socioeconomic disadvantages, also is being discussed when considering how effective the accessibility to DBS surgeries and other therapies are when looking at treatments for Parkinson's disease, and increased likelihood of acquiring DBS surgery were also linked to higher local socioeconomic levels. And studies have shown that deep brain stimulator surgeries and other surgeries are both more common in urban areas than in rural areas, especially in more well-off areas. And there's also an economic disparity in the use of DBS surgery, even among the insured patients, those who are covered by Medicare or other healthcare companies or programs. And individuals with zip codes with higher socioeconomic levels are also more likely to undergo the therapy, leaving everyone else who's not as well off with no chance to therapies and treatments like this. A recap on DBS and Parkinson's disease advancements in medicine is extremely important in taking a step closer to finding cures for diseases like Parkinson's disease and other illnesses. However, the ability for all to access such treatments without discrimination is even more essential and crucial in improving global health, public health, and just health altogether. These are my references. Thank you for listening.